Okay, hi everyone. So today we're going to talk about polycystic ovarian syndrome, also known as PCOS. So what is PCOS? It is a common endocrine disorder. It's usually found in women of reproductive age. So 8 to 13% of women in this age group have this disorder. It is characterized by hormonal and metabolic disturbances, which may become apparent in late adolescence, or it may not be diagnosed until a woman is trying to get pregnant. The causes of PCOS are not certain, they're unknown. We know that genetics play a factor. Most women with PCOS have a first degree relative, so a mother or a sister who has PCOS or PCOS symptoms. We do know that it's associated with insulin resistance and central obesity. And we know that during PCOS, the ovaries become filled with fluid sacs, so the cysts, and they do not regularly release eggs. Risk factors for PCOS, like we talked about, is having the first degree relative with PCOS. Substantial weight gain and obesity is a risk factor for PCOS. And really, it's sort of a chicken or the egg type theory. We don't know if women who are heavier or more likely to develop PCOS, or if women with PCOS become heavier because of the polycystic ovaries. We just know overall that women with this disorder are heavier than their same age counterparts that do not have PCOS. Signs and symptoms of PCOS, so that's irregular periods after regular cycles have been established. So this is, after a woman has establish a regular cycle with her period. This can include not having a period or having very irregular periods. Hirsutism, so the growth of hair in places where hair does not usually grow on a woman, such as facial hair. Alopecia, so the hair along their scalp may become very thin where you can see their scalp through their hair. Central obesity, so a disproportionate amount of abdominal fat. Acne, and infertility. So PCOS does account for 40% of fertility problems in women. How is PCOS diagnosed? Well, largely we diagnose it clinically by symptoms, and we use something called the Rotterdam criteria. So they have to have 2 of 3 of the following criteria. One is hyperandrogenism, which can be diagnosed clinically. So that's the excessive facial hair, the acne, or the hair loss, or they can have high testosterone levels on a blood test. Number 2, they can have ovulation dysfunction. So like we talked about, irregular periods or no period at all. And then also number 3 is polycystic ovaries on ultrasound. And they just need 2 of those 3 criteria to meet the criteria for PCOS. Impact on patients' quality of life is very big. There's a lot of psychosocial and physical factors that play into this disorder. They have a very hard time losing weight or maintaining their body weight. They have a difficult time conceiving. They have a lot of cosmetic concerns due to the acne and the hirsutism, the hair loss. They have body image concerns. And overall, they just reported in some of the studies I read of feeling very out of control of their body. They're attempting to lose weight and not being able to. They're attempting to conceive and not being able to. And so it's very frustrating for these patients. Because of these factors, they are more prone to anxiety and depression than their same age counterparts. They're more likely to develop cardiac and metabolic disorders like obstructive sleep apnea, diabetes, hypertension. They may have increased lipids. And so later in life, they are more prone to having a CVA or having a heart attack because of these long-term effects of these disturbances. Treatment for PCOS symptoms that are not related to fertility. So first and foremost is lifestyle modifications. Studies do show that a low-fat, low-carb, low-glycemic index diet is best for these women, but it's important to support them in whatever way they can stick with losing weight. So whether that be Weight Watchers or calorie counting, whatever works for them that they can consistently do. Combination oral contraceptives and metformin. Also anti-androgens, which are typically injectable medications. They are teratogenic, so the woman cannot become pregnant while she is on getting these medications. Various types of hair removal, which can be shaving, tweezing, waxing, up to electrolysis, various acne treatments, and emotional support and depression for treatment and anxiety. There's several adjunct treatments that are being researched. One is resveratrol, which is a phenol found in grapes. And some studies have shown that this can be helpful in decrease testosterone levels and also their fasting insulin levels. Statins, of course, if they have an elevated lipid profile, will be appropriate, but they may also decrease testosterone levels. Melatonin may decrease some of androgenic symptoms. Inositol has mixed results, so more research is needed, but some studies do show that it increases cycle regularity. And also our GLP-1s, which we know increase insulin sensitivity and have an overall anti-inflammatory effect. So treatment for infertility associated with PCOS. First line usually used is Clomid. That stimulates ovulation. There are some side effects like pelvic pain, hot flashes, mood changes. There are increased chances of multiple births on this drug. So the women take this drug for 5 days in each cycle, beginning on the 5th day of the cycle. And that's used for 3 to 6 cycles. The use of metformin, sometimes this will be enough to cause a woman to ovulate. It can also sometimes help with her weight loss. Usually it's 4 to 6 months before you see much result with that. And then Femara, which also induces ovulation, but it has less side effects and less chances of multiple births than with Clomid. Gonadotropins, which would include injectable luteinizing hormone and injectable follicle stimulating hormone. Laparoscopic ovarian drilling, which I don't think is done that often, but that is a surgery that includes cauterizing the part of the ovary that is cystic, which sometimes will trigger ovulation, and assisted reproductive technology, which we talked about a good bit in class, but includes in vitro, intracytoplasmic sperm injection, and cryopreservation, with IVF being the most common. Important points to consider as a primary care provider: compassion. PCOS is a multifactorial disorder. There is a lot going on in these women physically and psychologically. So we need to be patient with them. We need to assist them on their journey to conceive and for weight loss and managing their cosmetic concerns, and just be patient and compassionate and discuss their symptoms openly in a matter-of-fact manner. Know when to refer them, whether that be to a dermatologist, reproductive endocrinology, surgery, psychiatry, knowing when to get them additional help. And that is all. Thank you very much.